Welcome to McMaster Minds, a podcast brought to you by McMaster University's undergraduate psychiatry program. This podcast will explore psychiatry training and the path to getting there through honest conversations with residents and staff. We hope this gives you a sense about the life of a psychiatry resident and staff psychiatrist, and that it helps you make the decision about whether psychiatry, and hopefully McMaster, is right for you.
I'm your host, Caleb Mathai, and join me as I chat with Dr. Oliver Archer about his training as a resident in psychiatry. Dr. Archer, thank you so much for joining us. I know many people are excited to hear about your perspective, myself included. To start off, could you introduce yourself briefly to our listeners?
Sure. As you said, Caleb, Dr. Oliver Archer. I am in my third year of my residency here in psychiatry at McMaster University. And I am one of those sort of like quasi-Mac lifers. I also did my medical school here at McMaster as well.
Thank you so much for sharing a bit about yourself, Dr. Archer. Let's rewind to the beginning of your medical journey. When you first entered medical school, what specialties were you considering?
I'll have to admit right up front, I was not considering psychiatry. And, we could chat a little bit more about that. But it was like, I just had this image of psychiatry as being mental health. And I was like, ew, mental health. I don't want to do that. For those listeners who know the MAC system, broken up, the med degree is broken up into medical foundations. MF1 is like cardio resp. I did that. And I was like, yes, I love cardio. I love resp. Why not anesthesia? I thought it was going to be this great specialty for me in which I would be able to kind of marry the kind of physics that I really did enjoy. I've always kind of enjoyed math in my life. And for whatever reason, that was front of mind. And that was front of mind actually throughout much of the pre-clerkship period. I was so interested in anesthesia, kind of just trying to learn more about it. And in the meantime, there was this thing called psychiatry, I guess, but I had no sense whatsoever when I started my medical training that that's what I was interested in. I think there were some other periods in which I was maybe some internal med. I was never one of those sort of surgery gunners. I kind of had ruled that one out early, which is, one of the common decision points that I think a lot of medical students are prompted with first. Internal med, that came up. I didn't know exactly whether I would really pursue it, but it was all interesting. But psych, that wasn't there.
That is very interesting to hear. So what was it that first drew you into psychiatry?
I think, so it's sort of twofold, one of which was the anesthesia train crashing and burning. I had arranged, I carefully selected my clerkship stream. I think I was a yellow streamer for the record. And anesthesia was sort of, I guess it was kind of maybe April or something like that. And I had back-to-back organized or arranged it with an anesthesia elective, which in my year were quite competitive and hard to come by. And so I was feeling pretty good about this to have a good 4-week chunk in which I'd be able to, I don't know, impress, staff, whatever it was. And then the reality hit and I got into this, I think it was initially a little hesitation. Okay, maybe this isn't exactly what I wanted, but I was pretty still I was still kind of gunning for anesthesia. Week 3, it finally dawned on me, this was not the specialty for me. I'm not sure I was actually that good at it, at all. And on top of that, the parts of anesthesia that I enjoyed the most were the parts the anesthetist enjoyed the least, which is talking to the patient, calming them down beforehand, exploring their anxieties around surgery. I loved it. It was sort of it was a great moment in which I could connect one-on-one with the patient. But the anesthesia part was awful. And I could not I think the 4th week, it was just I just need to get out of here. This is clearly not for me. I would say right after that, though, I was just adrift. I wasn't sure what I was going to do. I'd done in the yellow stream, I think IM core is the first one you do. That was in rearview mirror. I wasn't sure if that would be it. And I think the next one up was emerge. I went through that trying to think gosh, could this be for me or whatever. I really didn't know. I just remember feeling like pretty low and pretty like I had no idea what to do. Mac is a compressed program too, right? Like it's 3 years. You got to make your decisions quickly. And I was at the stage of like, I don't have a lot of time to decide. And then the way the stream goes, right? It was psychiatry right after that. And that was the eye-opening stream, right? It was the psych rotation on inpatient, like acute mental health with an absolutely wonderful, like terrific preceptor who, so I'll just go on the record. This was like Dr. Gand. And I remember talking to some other like psychiatry staff here at Mac, other residents, all of whom were like, the reason why I did psych was Dr. Gand. And I have to say that I am also one of those individuals. It was this eye-opening experience of watching this very experienced psychiatrist interview patient, assess them, diagnose, treat. And it was everything that I wanted, but didn't know until that moment.
That is really interesting. And I'm a fellow Yellow streamer, so I can definitely resonate with the trajectory of your journey through clerkship. Do you have any particular areas of interest within psychiatry?
I think it's developed a little bit during the course of my training. At the outset, I recognize, this is a great thing. Some students come in, they're like, I know I want psych, and not only do I want psych, but I want like this specific part of psychiatry, what a geriatric child, whatever it is. I was very undifferentiated as a medical student, and then undifferentiated within psychiatry when I came in. And so one of the great things of, you have some time, you have wonderful access to all these staff, you're exploring these different areas. The program is very well structured. I think now I would say that my interests are a little bit more on the acute side, a little bit more hospital-based care, whether that's inpatient, really like the medical side of psychiatry. So maybe a little bit of CL, consultation liaison. PsychEmerge is, it's a good place. I enjoy PsychEmerge. Not every resident does. That's fine. It's not for everybody. I tend to enjoy that a little bit more on the acute side, but I don't sort of like lose the sense. Like, I think it's also important to become a well-rounded psychiatrist to also have exposure to outpatient, like the somewhat less acute, because that kind of can inform the way you practice in these other domains. So I'm kind of like not answering the question very specifically. I would say like in a nutshell, it's definitely on the more acute side. That seems to be my wheelhouse. But I have an appreciation for all aspects of psychiatry for sure.
For students who are still in the exploration phase, how can they tell if psychiatry might be a good fit for them?
Okay. It's funny because I think every sort of internal med, every emerge doc is going to tell you when you're presented with that patient, it's like, keep your differential broad, right? Like we all fall in this cognitive trap of zooming in really quickly on what we think is the most likely explanation for why this patient is presenting at this time. And the reality is we're often surprised. And every doc has a story of how they got burned by doing exactly that. Well, okay, let's use that as a metaphor for what you should do when you're considering a specialty. Remain undifferentiated, keep it broad. Don't stop exploring those other possibilities, even the zebras, like for me, kind of psychiatry was, which might actually be the answer that you're looking for. It's so important for medical students to be open-minded, to explore as broadly as their program structure allows a variety of different specialties. You never know how your personality quirks, your aptitudes are going to fit into a specific domain until you've actually tried it and see if it fits. That is definitely the advice that I would have given a younger version of myself. It's definitely also the advice I give to all medical students who ask.
Fast forward to residency. Listeners always want to know, what does the day-to-day reality look like within psych? Do you mind walking us through what a typical day might look like? And how might that differ depending on your year of training?
I mean, let's take it where I am right now, right? Like, so I'm in my third year of training, which is divided 6 blocks in child and adolescent psychiatry, which I'm doing right now in the outpatient world, and it'll be 6 blocks of geriatric, which is coming up. I'm doing outpatient child and adolescent psychiatry right now. But kind of like regardless of where I am, the way I structure my day is roughly the same. I'm getting all my kind of like morning stuff done, getting into whatever the office setting is or inpatient unit around like 8:30 or so, 8:30, or at least like half an hour before we're either rounding or discussing. The reason why is I really want to review some of the cases that are coming up during the day. It just helps me get a sense of what I'm going to need to do, what are going to be my priorities, et cetera. And then right now it's like seeing patients, right? So I'm going to be booked, whether it's a consult in 90 minutes, it's going to be a follow-up. In the child world, they're usually a little bit longer because you're often getting collateral, right? So that's going to be 60 minutes. I'm just booked, trying to get that kind of like stuff done, wrapped up within the time, and working on the documentation as well. So I don't have too much that kind of like falls over into either, lunch, which is very important. Encourage everyone to like protect lunchtime or even after. I'm fine when the work does kind of spill over a little bit. It is something we all need to be cautious about from like a wellness and balance perspective. I do want to make sure that when I am seeing patients, which is really the motivating factor for me, that I'm giving it my all in that moment. Sometimes you can like do a consult, I booked 90 minutes. Sometimes, honestly, that consult naturally wraps itself up much faster. Sometimes you need the full 90 minutes, and it's really going to be determined by how complex the patient is, what kind of opportunities you have for like some sort of like therapeutic intervention in that kind of like block of time. I have to read the situation as it is and see where it takes me. So I'm doing that, and that's basically like sort of like 9 to 5 as in the outpatient world. And then I'm wrapping up almost always on time. As I said, sometimes there'll be a few notes that need to be kind of polished up later on. And then it's rinse, repeat. And you know what? I love what I do. I am very motivated by those individual patient interactions. And that's what keeps me coming back every day.
And of course, everyone wonders about call. What does call typically look like for a junior versus a senior resident?
Yes, everyone does wonder about call. So we do Psych Emerge call at McMaster. There's some integration of inpatient call a little bit later on in your training as well, second half of the PGY2 year. So the Psych Emerge here is attached to St. Joe's Hospital. For those who aren't familiar, it's a downtown hospital. It is like sort of one of the main catchments for all mental health concerns in the city of Hamilton. There are some abbreviated shifts, like 5 to 11, Tuesdays and Fridays, one of which is actually dedicated just to the learning opportunities for junior residents specifically. That's the Tuesday night shift, where instead of it being, so your typical is going to be like maybe a senior and a junior, senior, couple juniors, whatever it is. This is a 2 junior shift with a faculty that stays in the department during the entire time, who's using that shift specifically for learning, basically meeting the learning goals of junior residents. It's a great kind of way of doing it. And then we have some overnight shifts on other days of the week, as well as like 9 a.m. to 11 p.m., like full day shifts over the weekend. I'm actually on call this Saturday as a senior resident, and I'm looking forward to it too. I get to work with great people, my co-residents, great faculty, as well as a great team, nurses, social workers, all allied health that are involved in Psych Emerge. As to how it differs from junior to senior, I mean, it is such a wonderful and good learning opportunity. I, again, appreciate the higher acuity and intensity, as well as some of the frank risks or safety risks that can be present in an emergency department. It's not for everybody, but we do our best to make sure that no matter what, everyone is well supported. And coming back to my main point, it's a great learning opportunity. So there's a little bit more call frequency for junior leaders, junior learners, wonderful opportunity for those learners to just get a sense of like the variety of mental status exams out there and how they kind of accord to their underlying presentation and what to do when you have that. That sort of, that recognition, that muscle memory, you want to build that early. Later on, when you become a senior resident, you take on progressively more responsibility. You have responsibility over managing effectively the flow of the department, triaging cases, assigning cases to junior learners, supporting the learning goals of those junior learners, seeing your own patients. So a little bit more responsibility. Of course, you're a little bit more comfortable, a little bit probably more efficient at that stage too. The benefit too of being a senior learner is that you get less call. So the call frequency decreases. And I have to say now, being in my third year, this is my first year of being a senior resident, which at McMaster is 3 through 5. That's a nice thing. For sure. It's nice. Not that call is like that frequent to begin with. It's 1 in 7 to 10, I think, for juniors, 1s and 2s, and then, a little bit less for seniors. It's a great thing. It's nice to not have to be going into the department as often. That said, I still see it as a really valuable learning experience and look forward to going in when I do.
We're just about coming to the end of our time together today. We have just a few more questions before we wrap things up. Now that you are further along in your training, how do you feel about your decision to choose psychiatry?
It's the best decision I ever made. It's hard to imagine, I parallel planned, as you're often encouraged to do, with family medicine, thinking that it would be kind of like a reasonable backup option. And I have to say that within days of starting in psychiatry, I was like, why would I have considered anything else? This is home for me. I feel just so fortunate to have found this specialty, to find a career where work just doesn't feel like work. So what can I say? Can I use like more superlative words? I have no idea. This is one of the best things that's happened to me, and I'm very, very grateful for the opportunity.
Is there anything that you appreciate about the field now that you didn't fully realize when you were making your decision?
That is a very good question. As I explained in my journey, I really didn't know much about psychiatry when I first came across it. And then you started to pick up more. I made my decision. It was almost a coin flip between psychiatry and family. And now, as I said, looking back on it, like I can't imagine anything else. I think that's because there's just such breadth in psychiatric practice, like the opportunities once you're through your training program of what you could do with your career, the intellectual challenge is wonderful. I mean, I get a lot out of that, just trying to understand what is going on with patients, how to best support them. And I have to say, just the ability to spend time with patients is something that I appreciate tremendously. It is, it's not an exact answer to the question. I just would say it's the breadth, it's the depth, it's almost everything about psychiatry is something that I've come to appreciate more than I certainly did before.
Dr. Archer, I know many listeners may be considering choosing McMaster as a place to apply to for psychiatry. Can you say anything about the community of the residents and supervisors at McMaster?
For sure. And I would say that this is just one of the huge, pleasant surprises. I'd heard a lot before I applied to MAC about the collegiality among the resident body. It's one of those things that you can sort of only appreciate when you've experienced it. And that is one of the things that I absolutely love about this program is how collegial we are, how supportive we are of one another. The support that I've received from fellow residents, whether it's swapping call shifts or just talking through a difficult patient or a difficult encounter. And that's not only within the resident body itself, but also I found that faculty are also equally supportive. We have a tremendous group of individuals here who, many of whom are themselves MAC grads, appreciate what it's like to go through the program, understand the challenges of being a resident, and are sympathetic to the demands that are placed on us. And I have found, almost, basically without exception, just it is a tremendously supportive faculty body here. So, there's really no knock against it. It's just one of the true strengths of the program.
What's one thing you wish you knew before starting residency?
One thing I wish I knew before I started residency. Oh, just how much I would enjoy it. It would have been like, I think you go through CARMS. It's just this real, just tough time. You're just stressing about the applications and everything like that. It works out. The system kind of like works as it should. And just being able to like know what it would be like on the other side, I think would have helped me maybe, I don't know, get through that with a little bit more equanimity. I just remember like just being in the trenches and having no idea what was going on. It's certainly like, hey, as I said, I'm happy where I am. It would have maybe helped me get through some of those stressful days if I had known just how I would feel at the other side of CARMS.
Well, thank you so much, Dr. Archer, for sharing your experiences and advice. I feel like as listeners, we now have a little bit of a glimpse into what it will look like on the other side of CARMS. It's always valuable to hear about the real thought process behind choosing a specialty. Before we wrap up, do you have any final thoughts or parting advice for our listeners?
I mean, good luck. It is a hard process. I certainly, feel, I could almost feel viscerally the challenge of going through this. I would just say, trust yourself, trust your gut, put your best foot forward. Things will work out for you.
And on a lighter note, what's one non-medical thing that's helped you survive residency?
This will come back to maybe, just other joys of living in Hamilton, a city I really didn't know very much before I came to medical school. It's a great place to live. I have had a wonderful time here. It is a green city. It's got a lot going on, restaurants, coffee shops. I think the things I enjoy the most and what actually like kind of helps protect my sanity day to day is the access to green space here in Hamilton, which is wonderful. Royal Botanical Gardens, Hamilton Conservation Area, the Bruce Trail, all of which are easily accessible from downtown Hamilton. These are places that I go when I need to unwind and kind of disconnect a little bit from the day job. So that's my way of coping. That's my wellness. I'm sure there's some folks out there for whom it would be the same.
Thank you again for joining us today, Dr. Archer. I'm sure our listeners appreciate your insights, and I know that we certainly do.